Hello everyone. Today's class we are going to discuss about the topic that is high risk newborn. So we are going to study about high risk newborn care and who all are the kids who will come under high risk. The first one is introduction. A newborn regardless of gestational age or birth weight who has a greater than average chance of morbidity or mortality because of condition or circumstances supreme imposed on the normal course of an event associated with the birth and the adjustment to the extra uterine existent. It means who will come under high risk newborn. First, the newborn who will be having the regardless of gestational age or birth weight. Maybe the birth weight is less, okay, or maybe gestational age is not completed, or the chance of morbidity. Morbidity means disease or mortality, death rate is more because of any circumstance the baby is not able to adjust with the extra uterine life means outside the mother womb, they will come under the high risk baby. Next is definition of high risk baby. High risk newborn can be defined as a neonate regardless of birth weight, size or gestational age who has greater than an average chance of morbidity and mortality, especially within the first 28 days of life. So the baby who is having the lifespan of 28 days, for them we will call neonate. So if the baby is having any condition like less birth weight or less gestational age or size is very small, okay, they have more chance to get the disease or there for death. For them we will call high risk newborn. Next is factor to define high risk infants. The first one is demographic social factor like maternal age, that is below 16 or above 40, means which factor can cause the high risk newborn. The first one is maternal age, mother age. If the mother age is below 16 years, okay, or if their age is above 40 years, it can cause complication in the newborn, okay, complication in the baby. Unmarried, why means, see, unmarried means it is not a nature in our society, so obviously the people they will keep it like hide, they will not go for a regular checkup, they will not have a proper food pattern, so there is a chance of getting high risk baby. Physical stress, if the mother is having any physical stress during the pregnancy, it can cause complication in the baby. And socio-economic status means money problem. During the pregnancy there is a lot of things they have to spend money, like for going antenatal visit, for scanning, for good food, good nutrition, so for that they need money. If they don't have proper economic stability, it can cause complication in the baby. The next risk factor is first medical history. In the first medical history like diabetes mellitus, genetic disorder or hypertension, means if the mother is having diabetes mellitus during pregnancy or before pregnancy, or any genetic disorder like gene related disorder, hereditary disorder, or hypertension, high blood pressure, it can cause effect in the baby. Then previous pregnancy, okay, this is first pregnancy. If the mother is having history of intrauterine death, means newborn death in the womb itself, in the uterus itself, neonatal death means newborn death within 28 days. IUGR, intrauterine growth retardation, means how much that weight should be, that weight is not there, okay. Then IEM, IAM means inward errors of metabolism. It means baby is having some problem or some errors in their metabolism process. Or congenital malformation means the previous pregnancy the mother was having the baby with congenital defect. The next risk factor is present pregnancy. So first, now we have seen the first pregnancy, what are the history can affect. Now we are going to see the present pregnancy. In the present pregnancy, if the mother is having vaginal bleeding, or if it is PROM, that is premature rupture of membrane, or if it is multiple gestation, means there is a more than like 2 or 3 babies, preeclampsia, that is hypertension, okay, And abnormal ultrasonography findings means during the scanning they have found out some abnormalities. Next one is labor and delivery. So in the labor and delivery, if it is obstructed labor, means delivery is not happening properly, it got obstructed because of some reason. Next one is fetal distress, means fetal is asphyxia, means आपका score is not good. Forceps delivery, if they use forceps for the delivery of the head of the baby, or meconium stain liquid, it can cause problem in the baby, or baby will become high risk. Next is neonates. In the neonates, if birth weight is less than 2 kg or if it is more than 4 kg, both is problematic. Normal weight in India is 2.5 kg. If it is less, it will be problem. If it is more, it can cause problem. Gestational age, okay, it should not be less than 37 weeks or it should not be more than 42 weeks. Respiratory distress or congenital malformation. Next, we are going to study about the classification of high risk newborn according to the size of the newborn. It is divided into 4 categories. One is low birth weight, one is very low birth weight, one is extremely low birth weight, one is appropriate for the gestational age infants. Okay, so there are four types of newborn according to the size. We have few more size, that is small for date, intrauterine growth retardation, and large for gestational age. So there are altogether 7 types of high risk newborn based on the size of the newborn. So now we are going to see one by one. The first one is low birth weight, okay, LBW infants. So who will come under this category? A baby whose birth weight is less than 2.5 kg regardless of gestational age. So already I have told, in India the normal weight of the baby is 2.5 kg. So if the baby born less than 2.5 kg regardless their gestational age, it may be 37 weeks or maybe 48 weeks, that is called as low birth weight infants. The next one is very low birth weight, that is BLBW infants. A baby whose birth weight is less than 1500 gram, means that is 1.5 kg. It can come under the very low birth weight. The next one is extremely low birth weight, that is a baby whose birth weight is less than 1000 gram or 1 kg. They will come under this extremely low birth weight. The next one is appropriate for the gestational age infant. An infant whose birth weight falls between the 10th to 9th percentile on the intrauterine growth curve. We have a growth curve where we can measure the growth rate of the baby during the pregnancy. So in that, if the baby's weight come between the 10th to 19th percentile, it can come under the appropriate for the gestational age. The next one is small for dates or small for gestational age infants. An infant whose rate for intrauterine growth was slowed and whose birth weight falls below the 10th percentile on intrauterine growth curve. The next one is intrauterine growth retardation, means the baby who do not grow adequately in the uterus, will call them intrauterine growth retardation. The last one is large for gestational age, means see the one is small, one is large, so it should be below the, like normal it is 2.5, but if it is more than that, okay, if it is above 10 percentile, we'll consider it is large for gestational age. Compared to 37, like in the 37 week of gestation the baby should be 2.5 kg, but in this case it is more, like it may be 4 kg or 4.5 kg, so we'll call them large for gestational age. The next one is the classification according to the gestational age. As you have seen, the first one is classification according to the size of the newborn, and this one is according to the gestational age, means normal gestational age is 37 week, okay, means period of pregnancy, that is called a gestational age, 37 weeks, or like 37 to 40 you can consider it is normal only. So the first one is premature or preterm infants. A baby born before the completion of 37 weeks of gestation regardless of their birth weight, then we'll call them preterm baby or premature baby, means if the baby born below the 37 week of gestation, we'll consider them preterm or premature. The next one is full term infants. An infant born between the beginning of the 38 weeks and the completion of 42 weeks of gestation will call them full term infants. The next one is post term infants or post mature. An infants born after the 42 week of gestational age regardless of birth weight. See, everywhere they have mentioned the regardless of birth weight means birth a weight is doesn't matter, it may be normal or it may be below or it may be more, but here we are considering only the week of pregnancy. So if they deliver after the 42 weeks, we'll consider them post term or post mature infants. The next one is near term or the late preterm infants, means an infant born between 34 and 36 week of gestation, we'll consider them near term or late preterm infants. Okay, the next one is classification according to the mortality, means according to the death rate of the newborn. It considers four types. One is live birth, one is fetal death, one is neonatal death, one is perinatal mortality. Mortality means death rate, morbidity means disease rate. Okay, so the first one is live birth, the birth in which the neonates manifest any heartbeat, breath or display the voluntary movement regardless of gestational age, means they have delivered a baby in the live condition, then the baby got death. Okay, that is live birth. Next one is fetal death, death of the fetus after the 20 week of gestation and the before the delivery with the absence of any signs of life after the death, means if the baby death before the delivery and after the 20 weeks of pregnancy, will consider them fetal death. Next one is neonatal death. As we know, after 28 days of after the born of the baby, we'll consider them neonate. So if they died before the 28 or within the 27 days, we'll call them neonatal death. Next one is perinatal mortality, total number of fetal and early neonatal death per 1000 live birth, means if there is 1000 live birth, within the 1000 live birth, how many babies got dead within the 28 days, then we'll call it is perinatal mortality rate. The next one is diagnostic tools for recognizing the high risk newborn. There are pulse oximetry, ABG, that is atrial blood gas analysis, chest x-ray, STC determination, CVC, blood culture, urine analysis, lumbar puncture, ultrasonography, CT scan, MRI scan, echocardiography, electrocardiography, passage of orogastric tube. The next one we are going to study about the care of high risk newborn. See, till now we have studied about the introduction of high risk newborn definition, the risk factors and the different classification based on the size, based on the gestational age, based on the mortality, and we know how to find out that they are high risk. So now what are the main, okay, normally they also need the immediate care like normal newborn, but they need some special attention. Okay, so that we are going to study now, care of high risk neonate. The first one is systematic assessment, that is feeding behavior, activity, color, oxygen saturation and vital signs. Okay, next one is monitoring the physiologic data of the newborn, respiratory support and supplemental oxygen and the artificial ventilation, thermoregulation, that is through the kangaroo mother care, protection from infection and hydration and supplemental parental fluids. Next one is nutrition, breastfeeding, gavage feeding. Gavage feeding will go if the baby is unable to take the breastfeed, then only will go for the gavage feeding. Skin care, administration of medication based on the condition of the baby, family support and involvement, facilitate the parent infant relationship. It can improve the health of the baby. Okay, mother and the family, then family and mother will allow them to make a bonding with the newborn. Okay, so with this we have completed the high risk newborn care. So we know that who are the comes under high risk newborn and how we can take care of them. Thank you everyone.